On the rise again, a third wave of the COVID-19 pandemic is now advancing swiftly across much of Europe. Health services are being stretched and yet more lockdown restrictions are being brought in. Could it have been avoided? This is Roundtable. Hello, I'm Shuli Ghosh. European citizens could be forgiven for thinking they'd left the worst of COVID-19 behind this winter, but a rise in cases has led to more ominous headlines. A variant of the virus first identified in the UK is spreading quickly in some countries, apparently helping to account for sharp rises in infection rates and numbers of cases. On the same day last week, Italy saw 24,935 daily new cases, with 423 daily new deaths. France saw 34,998 new cases, with 268 new deaths. And Germany saw 17,860 new cases, with 201 daily new deaths. All this while vaccination problems continue. The EU's rollout has been hit by months of criticism for being too slow. And dozens of European countries temporarily suspended the use of the Oxford AstraZeneca jab over reports of small numbers of blood clots. So, was a third wave in Europe inevitable, or could it have been avoided? Well, let's introduce today's guests. Joining us on Roundtable from Geneva, Antoine Flau, Director of the Institute of Global Health, University of Geneva. In London, Oksana Pizik, Global Health Advisor and lead of University College London Outbreak of Infectious Diseases. And in Bergamo, Dr. Roberto Cosentini, Head of Emergencies at Papa Giovanni 23rd Hospital in Bergamo. Good to have all of you with us. Roberto, let me start with you, because a year ago, we were looking at those appalling pictures coming out of hospitals in Italy where doctors were struggling to cope with the first wave of coronavirus. What is the danger that that scenario is going to repeat itself?
Well, I'm relatively optimistic now when we think back on what happened 1 year ago. 1 year ago, we had in our emergency room more than 100 people waiting for a bed inside the hospital, and now we have 10 to 15 people a day waiting for a bed in the hospital. So it's totally different situation, and also vaccination started here in Italy on the 27th of December, and I think more than 10% of our population got at least one shot of vaccination. So I think we are moving maybe a bit slowly. We should go faster, but we are moving to turn the page.
But what do you make of the rising number of cases, though? Are you concerned that there's another wave on the way?
We are on the third wave. That started 1 month ago, and I think that this week will be the peak, and then at the end of this week we'll reach the plateau, and then we go down in the next few weeks. But I think it's manageable this time, and also our effort now is not only to admit patients from our region, for our area of Bergamo, but also accept and admit people from other cities in our region in Lombardy, which that have been hit more severely than Bergamo during this wave.
Antoine, it's good to hear a doctor who's been at the centre of things saying that they feel it will be more manageable this time. What are your thoughts on the third wave, and how is it different to the waves earlier on?
In fact, I would say that the third wave started in Central Europe and in a way in Mediterranean Europe, with also an important increase in case in Greece, in Croatia, in Serbia, but also in Central Europe, mentioning Czechia, Slovakia, Hungary, Poland, Bulgaria. All these countries experience and are experiencing a huge wave with some similarities from the first one, which was mentioned and described by Roberto in Bergamo, but of course different. And probably Czechia is also experiencing a peak currently, so it is decreasing. That's a good news, like in Italy, where you expect that this peak will occur this week, this upcoming week. We can say that the profile, and I would be very happy to know about Italy for that and London, but we think that this wave has a different profile in terms of age distribution. The young generations seems more affected by this wave than the older one because of the vaccination, most probably. In fact, we see people, young people, or at least younger people, in intensive care beds where they stay for a longer period of times because they are healthy and they will be saved. They will not lose their life for most of them, fortunately, thanks to intensive care. And I think for the moment in Europe, there is 4 countries which may escape from this third wave, or at least 3 of them, the UK, Ireland, Portugal, and maybe Spain. But all the others seems to be, for the moment, heavily pressed and pushed by this third wave to enter into their countries. Of course, I'm not talking about Iceland, which is a remote island in the middle of Atlantic, which is not involved by this third wave, fortunately.
Oksana, why is it, after all the precautions that we've been taking, that cases and number of deaths are on the rise in several countries across Europe?
Well, we did see among several countries that there were some relaxations of regulations and restrictions, particularly around the Christmas period, to allow people to have a bit of a respite. Certainly in the UK, that had a knock-on effect in terms of then seeing that these variants that had reached our borders, particularly the B117 known as the Kent variant, led to a spike following that. So what will have to happen, and has already happened in some regions, is reinforcement of stricter again, measures, public health measures. Germany is now also saying that medical grade face masks are going to be required. So it's essentially, as soon as we take the foot off of the brake, it's going to start creep forwarding again. And we know through exponential growth, it's not going to take very long to reach that, particularly due to the more transmissible profile of these variants that are now largely responsible for the third wave that we're seeing across Europe. So also in other countries such as the UK, we have had a higher proportion, significantly higher proportion of individuals who have been vaccinated. So couple that, even just a little bit of relaxation alongside a sluggish vaccine rollout, means that inevitably these case numbers are going to rise. And that's not just a trend within Europe. Globally, we see over a 12% increase in cases, Brazil being an absolute hotbed of new infections and a public health crisis at quite an extreme level, with ICUs again being maxed out, and that's in a different international context. But we should be paying attention, because there could be further variants that make their way back to Europe and to the UK.
You've talked about the variants there, and of course there is a lot of concern over the spread of variants in Europe. This is what the French Prime Minister Jean Castex had to say last week.
Yes, as you know, ladies and gentlemen, we are in what looks to be a sort of third wave, which is characterized by several variants. And in any case, the so-called British variant is becoming more and more present.
Oksana, if I can just come back to you, you talked about the variants. How worrying is the spread of different strains of coronavirus? Because there is no guarantee that vaccines are going to work against every strain.
Yes, and in particular, there's been a very interesting results coming out of the New England Journal of Medicine that shows the AstraZeneca vaccine having limited efficacy against the South African variant itself. So again, that means that given that the UK and actually the world is heavily reliant on this particular vaccine, it's been described as a vaccine for the world, we should be paying attention to these variants. Now, the pharmaceutical companies are giving their reassurance that they'll be able to tweak the existing formulas and create a second generation of vaccines. But actually, we will have to wait and see as to how new variants emerge, because due to the vaccine inequity, the unequal distribution of vaccines globally, we are favoring the virus in terms of the rate of mutations, particularly in areas where the rates of transmission are increasing. So if you have low vaccination rates, high rates of transmission, again, little or no access to both treatments and vaccines that are needed, this is just going to, again, prolong the pandemic. And I've been disappointed to see that further discussions around increasing the manufacturing globally have been shut down by many high-income countries due to patent restrictions.
Well, let's talk about the vaccine rollout, because this is one of the things that the EU has been heavily criticised over. Roberto, you said that the vaccination programme had begun in Italy, but Italy is one of those countries which is complaining about lack of access to vaccines. It's actually considering manufacturing the Sputnik V Russian vaccine to try and fill the gaps. What's your view on how the vaccine programme is being rolled out?
Well, as you said, we had problems with the provision of the vaccine in January from Pfizer, so we slowed our speed in vaccination, in people vaccination. That was a problem that probably contributed to the spreading of the virus during the third wave.
That must fill you with despair as a doctor.
No, I'm not in despair. But I think that all these factors, the lack of vaccine, the variants, the British variants and the other variants with the higher rate of spread, underline the importance of the preventive measures. We cannot relax about, because they are still now, even with vaccination, the most effective way to reduce the spreading of the virus. So wearing the mask, washing hands, observing the physical distances. I think this is the most important effort we have to do still now, because it's still our main, our most important tool we have.
So continuing restrictions is the most important tool. Antoine, what do you think about that? Because the whole rhetoric surrounding the vaccination rollout was about being able to end restrictions, but we seem to be in a holding pattern where the vaccinations aren't happening as fast as they could across the EU, and more countries are having to either keep or reintroduce lockdown restrictions. It's so frustrating for everyone.
Yes, it is. We could say not so expected that a third wave will come just before the vaccine coverage will gain a majority of the population. The good news is that we have heard yesterday that the European Commissioner Breton said that most of the Europeans will be vaccinated before the 14th of July, he said. So if that's true, because he is in charge of the deployment of the vaccine campaign in Europe. So we can think it will be true, of course. So we can think that he assumes that we will have enough vaccines in European Union to vaccinate all the citizens during this time period before the summertime. And that would be a great news, because I do believe that when people will be massively vaccinated, if we win the race against the variants, and if the variants do not escape from the vaccine immunity, then we will be much more secure to live with and lift some of these measures, preventive measures, in case we are, most of us, vaccinated against this virus.
That's a really interesting point about getting most of us vaccinated, because there is quite a significant proportion of people who don't want the vaccine. Is that going to cause a problem in terms of seeing future waves of coronavirus making its way through Europe?
You know, we may consider problems after problems. The first problem is the problems of access to this vaccine. There is not enough vaccines available, doses. The jabs are not available enough for European citizens today. So when we will have enough vaccines, if we do not want it, I think we will distribute it to the other people in the world who ask for vaccines. And that will be, of course, very disappointing. But we are not here. For the moment, we still are in shortage of jabs. And so the more we will make them available, and the more we will be protected. So for the moment, I cannot consider, it's very frequent that a full population is not vaccinated. And the herd immunity is probably not 95% like for measles, but it's probably closer, we can hope, but it's just mathematical modeling. We will see that with Israel maybe, or with other countries, maybe with the UK, that with 60 or 70% of the population vaccinated, we will really decrease the probability of new major outbreaks in the country.
Well, let's hope so, because at the moment we're in a situation where several European countries are introducing new restrictions. Germany's looking at extended its lockdown. In France, 16 regions, including Paris, have gone into lockdown. Hungary has extended its lockdown. Italy has also introduced new restrictions. This is what Prime Minister Mario Draghi said earlier this month.
The memory of what happened last spring is still vivid, and we will do everything possible to prevent it happening again. On the basis of scientific proof, the government has adopted restrictive measures that we think are appropriate and proportionate.
Oksana, there have been so many restrictions for so long. It's really taken its toll, hasn't it? Not just on the economy, but on people's mental health.
Yes, certainly. I think this is also another reason why we need to ensure that we accelerate the vaccination program, because that is the way out of the pandemic. But until we have reached that, at least 70 to 80% of the population, restrictions are going to be needed. And I think that's particularly going to be a sore point for those who are hoping to have summer holidays ahead and are fed up. But we will pay a higher price if we think in the long term and through continuous cycles of lockdown. We need to look to the other countries that have done this successfully. Plenty of Southeast Asian, Australia, New Zealand, Taiwan, Thailand, Vietnam have all managed to show that actually they've not even had to have as many restrictive measures in place and control the level of transmission. So until we are able to do that and learn from the case studies a year later now about what does actually work for this coronavirus, then we will be just doomed to repeat those same mistakes and prolong it. So we have to have a long view on this rather than the short-term desire to go abroad for a summer holiday.
Do you agree with that, Roberto? Do you think that it's going to be a long time before we can keep transmission levels low enough to resume normal life, how life was before we'd even heard of coronavirus?
Well, I think it will be a long way, but I hope not too long. It would be crazy to relax just now that we are close, much closer to the end of the pandemic now than 1 year ago, and I think that we have to do such an effort. Because we learned from the first and the second wave, and in the area of Bergamo during the autumn and winter, more than 50% of the population got a vaccination for the flu, which for us was a great increase because we started from less than 20%, and actually the flu has gone. The regular flu, I mean, this winter, because we saw very few cases. So if we stay with the preventive measure, I mean the masks, the washing hands, and physical distancing, I think we'll see the end of the pandemic.
Antoine, can I ask you about the UK, which has had a very different experience recently from the rest of the EU? In the UK, we've vaccinated half the population. We are looking at a roadmap out of restrictions, hopefully by summer. But everyone says the caveat, whatever happens in Europe seems to happen in the UK a couple of weeks later. Given that there is an argument going on now about how many vaccines actually arrive in the UK, do you think that we should be really cautious in this country when we're looking at the possibility of another wave hitting us as it is in Europe?
I think it's an excellent question. And I would like to refer to what Oksana said. If we learn from other countries, and particularly Oksana mentioned some champions in the world regarding the fight of this pandemic. If you see China, but also Thailand or Japan or South Korea, you have some examples of countries which succeeded to at least suppress the risk of circulation of the virus. And if the UK and Ireland and maybe Portugal decide that this time they do not want this stop and go, this lockdown and lifting, which reiterate every 6 or even less months, if they want to try to suppress the risk, they will need to reinforce their borders, their border controls, I mean. They will need to implement a backward contact tracing, and all these measures belongs to the package of the suppression strategy. You know that in Europe, all the countries except Iceland maybe were in, maybe also Norway and Finland to some extent, we were in a mitigation strategy which was very poorly effective in this pandemic. We did not succeed at the same extent as the Asian and the Pacific countries. So if the UK decide now to change their strategy, because they are in position to do that, they are almost in the green zone, they are almost in a zone where the circulation is very low. If they want to finish the job and to try to eliminate the circulation of the virus, in addition to their own vaccination, they will be much safer in the future.
What do you think, Oksana? Do you think we have, the world has learned from its lessons from past pandemics? Are we looking to a future where we might face more waves, or do you think that we are gradually being able to bring this under control?
Well, we have seen a shift, at least in the UK, in terms of the tagline, data, not dates. So I think there has been a pivot towards a maximum suppression strategy, which previously was not implemented. However, other countries around the world, I would say there is almost no uniformity. It's still not a global coordinated response. We have pockets which can only be described as disaster zones in terms of the rates of transmission. So I would say actually that lesson has not been uniformly learnt, but it is being applied in some regions in the UK, has taken on board some of that, I would say.
Okay, a big thank you to all my guests. That was a really interesting discussion. Antoine Flao, Oksana Pizik, and Roberto Cosentini. And you can see more discussion and debate on our YouTube channel. Search for TRT World Roundtable. For now, from me and all the team here, bye-bye. Thanks for watching.